to learn a little bit more about your health. Some of you I know have seen my talks, a lot of my talks, and so this introduction might be a little bit repetitive, but it is my goal to educate our community to be a healthier community and a healthier society. Come on in.
Hey,
Yeah,
Paul.
come on in. Yeah.
Short circuit your brain tonight?
Yeah.
Okay.
Yeah, have a seat.
Carmen,
Yes.
you can't connect to Lincoln Disc.
Oh, and the watch.
Pull that around. That's all right.
No,
And
you
you
guys
guys
are
are password. Oh, well, we can sit together.
So, as most of you know, and as I've stated, and is obvious to a lot of people, we live in a profoundly unhealthy society. And if you go, I was just looking at an article today from the Journal of American Medical Association, going all the way back to 2000. They were comparing the United States to all these other countries, and we were, in terms of developed countries, pretty low on the health scale. And I think like Cuba might be ahead of us. You know, I mean, it's pretty bad. And so I want to communicate and teach people how to be healthy. Okay, and I think you can. I think that we can avoid hip and knee replacements if we take care of ourselves. I think we can avoid things like disability if we take care of ourselves. I'm going to talk a little bit more about that tonight. My mother, who's 93, who I'm going to go see on Saturday, she's never had a hip or knee replacement. She walks around, she does all kinds of things. So we can avoid those things if we take care of ourselves. We can avoid chronic illness if we learn to take care of ourselves. And so that's my goal in these talks, is to teach people how to do that. Now, I'm going to ask you a question tonight. What are the systems of the body? Anybody remember back from, high school, grade school? What can anybody name some of them?
Circulatory.
Could that be cardiovascular?
Okay, cardio.
Right? That's right. Okay.
Lymphatic.
Lymphatic. Good. Good job.
Nervous.
Nervous system.
Digestive system.
Digestive system.
Cranial sacral.
Musculoskeletal system.
There you go.
Okay.
Okay.
Reproductive.
Reproductive system. Okay.
Would the cranial sacral count? I mean, that's within the last
Part of the nervous
30
system.
years that they've kind of
Yeah.
figured out. Okay.
Okay. Urinary system. Respiratory system. Integumentary system, which is our skin. Okay. So, of the systems of the body, what system is the most important?
Digestive.
Okay, you say digestive. Okay. Anybody else?
I think they're all important, because if you don't have one of them, everything else goes to heck.
Yeah, well, that's true. Okay, but what's the most important system?
Probably the nervous system.
It's the nervous system. Because if you don't have the nervous system, nothing works. Okay, and there's the endocrine system. That's an important system. Okay, without the nervous system, nothing works. Now, the digestive system is, I would say, is second. Okay, now you think, well, what about the integumentary system? If you don't have any skin, you're not going to do very well, But the digestive system would be second. So tonight, we're going to talk about the nervous system. Okay, I'm going to make this thing work. Why is this not working? Let's see. What if we do this? There we go.
Yay.
So the nervous system can be compared a little bit to like a safety pin, okay? Brain, body, and then you have loops of communication between the brain and the body, okay? So think of it like that. So every time you see a safety pin, that's what I want you to think of. A subluxation, it's a misalignment of the vertebra, putting pressure on the nerve. It's like right? Releasing the safety pin. Now, it's not quite this severe because you don't have a complete cutoff from the brain to the body. You have a partial cutoff. But I want you to get this image in your head because it actually works pretty good. And all doctors who care about the health of their patients, before they diagnose someone, before they work on somebody, really need to know about this because this is a thing that runs your body. And if this isn't working, okay, how many pharmaceuticals do you have to take to make your nervous system work right? There aren't any, okay? They'll dull it down, okay? What's one big pharmaceutical that'll dull your nervous system down really well?
Opioids?
Opioids, painkillers. You know, that's why people get constipated when they take painkillers, because painkillers dumb down the nervous system, all the nerves that surround the colon. The colon can't work right. So, okay, so this law, this is not a chiropractic thing, okay? This is a basic tenet of physiology, is the brain sends messages to the body, okay? And that's called the efferent nervous system. The way I can remember that is E stands for effervescence, so like bubbling out of your brain into your body. It's the only way I can remember that. So sends messages to your body adapts, and then sends messages back to your brain, okay? And your brain analyzes the messages, changes what's going on in your body, and that system goes on all the time. So I want you to understand this. Sickness, anytime you have a sickness, anytime you have a symptom, anything like that, that's an adaptation of your body's systems, okay? I don't care if you've got cancer. I don't care if you just died, you fell over with a heart attack. Everything that happens in your body is an adaptation of what's going on in your body, and it's adapting and doing its best to survive. Everything, okay?
Can you explain that a little bit more when you say it's adapting? So like an organ is not, say the heart's not, AFib or whatever. So it's sending signals to the brain's trying to sort through this is not correct.
Yeah.
And then it's trying to speak back to the heart and they're not in sync.
It's telling the heart to do the best it can with what it has.
I see.
But see, if you have clogged coronary arteries, if you have really low, super low potassium, sodium, or magnesium, heart ain't going to work right. Okay? But the brain is going to do what it can to help that heart work properly. And the heart will adapt. I mean, AFib is probably an adaptation to something going on in the heart that's not normal. Now, it could be a virus. Hey, Terry.
Oh, I'm sorry.
It could be a virus. Could be low electrolytes. Could be a lot of things. Okay.
Yep.
But
that one
everything that happens in the body is an adaptation of something that's going on. Let me give you an example of that. So let's say you get sideswiped by a car and your head just jerks to the side. Okay. So now your head is sitting over here like this, and your eyes you can't be walking around like this.
Right.
So your body has to rotate your spine to get your head as level as it can to keep your eyes level. So it creates a curvature of the spine to keep your eyes level.
To adapt to that. Okay.
So when you have a curvature of the spine, all of a sudden now you have subluxations or nerve interference to different organs in different places in the body. So now you might have numbness in your arm, or sciatic pain, or a liver that doesn't work, or a digestive system that isn't working quite right, because your body's going to level your eyes. So it adapts, it does everything it can to adapt to the inputs that you put into it. Okay?
Thank you.
So anyone who does not know this or respect this and understand these two pathways, the afferent and the efferent pathway, before implementing the diagnosis is violating some of the laws, the fundamental laws of how our bodies work. And so when you think about that, here's a good example of that. So So is back pain normal?
No.
No. Does back pain mean that there's something going on?
Yes.
Yeah, it does. Okay. So what's the typical, what would be a typical medical treatment for back pain?
Cortisol shots.
Could be cortisone. We're going to talk about that in a minute. How about muscle relaxers?
Mm-hmm.
You know, I see that a lot. People take muscle relaxers. Is back pain a muscle relaxer deficiency? No. Back pain is an adaptation, is something that's going on in your body that's producing pain. Okay? So if you don't really understand this, then how is your body going to work? How is a physician or somebody going to implement a diagnosis that's really going to be congruent with what your body's trying to do to feel safe? It can't, okay? Now, that doesn't mean that everything that medical doctors do are wrong. I'm not saying that at all. What I'm saying is that what I've seen in my office is so often people get a drug for this, a procedure for this, and then it creates another problem, and then they get a procedure for that, and it just goes on and on and on. And those people that I see that do that get into that system never get better. They never get better. Okay. So how important is nerve supply from the brain to the body? Here's bad scenario number one. The guillotine, okay? So when the head is severed from the body, the individual dies instantly, okay? Anybody disagree with that? Okay, the question is why? Why does somebody die instantly? Now I have the answer right up there. No electrical signals from the brain to the body. You cut that off, you die instantly. You cannot live for 1 second without electricity from your brain to your body. Cut your head off, you die, okay? So let's look at bad scenario number two. Christopher Reeve, a partial severing of the nerve supply from the brain to the body. Much, but not all of the nerve supply is cut off. And that was, everybody's been around for a while, remembers when that happened. Tragedy.
Yeah.
And I mean, the poor guy aged like so fast after that. And then he died and his wife died shortly thereafter. And it's a real tragedy. But yeah, those things happen. Bad scenario number three, subluxations interfering with the nerve supply from the brain to the body. So this is what chiropractors treat. Here you have a swollen disc, you have an inflamed joint, and pressure on the nerve. So a minor subluxation can cut off 60% of the nerve flow to an organ or muscle, and you may not even know it, okay? Chiropractors correct subluxation. So let me give you an example of this. I see it every single day in my office. In fact, many of you have experienced this. How many of you come into my office, I'll lay you down on your back, and I have you lift one leg, and I test the strength, okay? And how many of you ever experienced that the leg was weak? Yeah, everybody, yeah. How many knew the leg was weak when you came in? You may have known it, but most people don't, okay? That's typical of a subluxation. So you cut off the nerve supply, you can't hold up your leg, but you don't even know it, okay? So you can have 60% of the nerve flow to an organ or a muscle cut off and not even know that there's a problem, okay? I see it every single day in my office. So if that subluxation is left there and you don't do anything about it, eventually it'll destroy your spine. You'll get osteoarthritis, and eventually the joints will fuse, and you might have a lot of you might have pain, you might not, might have a lot of nerve interference, you might need, some sort of corrective neurosurgery or orthopedic surgery to fix it, but eventually this is what will happen if you just let things go. So let's talk about the brain. The brain is constantly doing its best to adapt to what's going on in our system. And so I'm going to talk about this in just a minute, but most of the problems, the health problems, actually originate or have issues in the right frontal cortex, okay? So what happens if your brain is healthy? There's no evidence that a healthy brain can create sickness in the body. So even if you never exercise to keep, and you constantly eat junk food, your brain's going to do everything it can to keep you healthy. It'll do everything it can to adapt your body to be as healthy and to work as well as it can until it can't adapt anymore. Then what happens? You die, right? You die, okay? That's what happens, okay? So let me give you a quick example of this. I can give you a couple examples. One is there was this girl in England who was 16, just collapsed. They took her to the emergency room. They didn't know what was wrong with her. They couldn't find anything wrong with her. So they started talking to her mother, and they started asking her questions. Her mother said she'd never eaten anything except chicken nuggets from the time she was 2. So her brain did everything it could until it couldn't anymore. And then she just collapsed. Your brain will try and keep you healthy as long as it can, okay? And we see this all the time. People, anybody in here know people that just eat a lot of junk food and fast food? We all know people like that, okay? And eventually, what happens to them?
They die.
Well, everybody dies eventually, but eventually they get symptoms, okay? They get issues, okay? And the brain will do everything it can to prevent that until it just can't adapt to that anymore, and then it creates symptoms, okay? So let's look at the central nervous system. You know, you start with 2 cells, a sperm and an egg. They divide exponentially. Here's the thing that happens. The brain and the spinal cord, first things to form in the body. Anybody know that?
Yep.
Brain and spinal cord, very first things that form. Okay, why is that? Why do they form first? Anybody?
Because they tell the rest of the body how to develop, maybe?
Good job. That's exactly the right answer. The brain and the spinal cord direct the development of the baby after that. Nerves grow off the spine, off the spinal column. Organs develop off the nerves, off the ends of the nerves. And it's the brain and the spinal cord have to develop first because they direct the development of the baby, okay?
It's like the conductor in a symphony, maybe?
Yeah, very good. That's exactly right. In fact, I'm going to use that analogy later on, so you're ahead of me, Nancy.
Okay.
You're way ahead of me.
I'm just seeing this beautiful picture. It's like, man, Lord, you know what you were doing.
Yeah, that's right. That's right. And so that's what happens. So this happens really early on. So it's really important that, you know, mother doesn't take pharmaceuticals and things really early on, because that can affect the way this works. So the body tries to protect things, and you learned some of this in my day 2 talk when I explained your x-rays, that the central nervous system is the only system in the body that's completely encased in bone. Okay, so we have ribs that protect our vital organs. By weight, bone is 9 times stronger than steel. So is it a coincidence that our central nervous system is encased in bone? Most important system in our body, completely encased in bone. Okay, so subluxations have been described in 4 different ways, and I'm not going to spend a lot of time on this. There's a lot of discussion about this in chiropractic. You know, is it dysfunctional movement, a joint, irritating a nerve? That's the easy way to explain it, except now we know it doesn't quite work like that. Is it an inflammatory process of ligaments and discs? Perhaps. Sometimes you can have outright compression of a disc, and you can see that on an MRI, except, here's the thing, here's the interesting thing about that, is that they've done studies on MRIs where they've just taken asymptomatic people off the street, done MRIs on their spines. And on a lot of these people, not all of them, but some of them, they found huge bulged discs compressing the nerve. And they had no symptoms. No symptoms at all. Okay? So it isn't always that. And so when MRIs came out and they became popular and well used, what happened is as surgeons would look at an MRI and they'd see somebody had sciatica, and they'd see this nerve in the lower back, or this disc bulged, herniated, pressing on a nerve, and they go, bam, that's what we need to do. We need to fix that. And it makes sense, doesn't it? Except a lot of times when they fixed it, the person still had sciatica when they woke up. So that was an adaptation of the body. The sciatic was actually being caused by something else. And so the problem wasn't necessarily fixed. Now, sometimes it is, but not always, okay? So, if we look at the brain, a lot of what happens in the body comes out of the frontal cortex, especially the right frontal cortex. So if you look at what happens in the right frontal cortex and what it does in the body, it relates to our mental health, our immune system. It affects our immune system, inflammation, endocrine, gastrointestinal, pain and stiffness, sleep, blood pressure, heart rate, attention and focus, all from our frontal cortex, especially the right frontal cortex. What we know now, and we have absolute stone cold positive research evidence that's been published, that chiropractic adjustments change the processing in the prefrontal cortex. Changes this, okay? So when you get adjusted in my office, I'm actually changing your brain. I'm changing the function of your brain. And all of these things, or any of these things, can change. Now, they don't always change, and not all of these things change, but they can, okay? Because we know now through research, and the woman that's done most of this research is that woman right there, Heidi Havoc. She's from New Zealand. She's done a lot of research. What happens when you adjust somebody? What happens in the nervous system? What happens in the brain? Here's something else. Proprioceptive processing changes with adjustments. Now, what's proprioception?
You're aware of your surroundings.
Okay, that's
your
one way.
Your body in space.
Yeah.
And,
where's your body in space and time?
Yeah.
What's another sort of a common way of describing proprioception? It's coordination. Okay, hand-eye coordination. So it changes proprioception, information from upper limb and lower limb. Okay. Now here's all the research studies, all the published research studies that show that. They're all on the side here. Now, what does that mean? Well, that means that hand-eye coordination gets better when you get adjusted. But take the clumsy kid, the clumsy 6th grader, the clumsy 12-year-old that trips over their own feet. Okay, what's the issue there? It's proprioception. Okay, so you can change that by adjusting that kid. Okay, now here's the interesting thing. Once the NFL finds this out, all the players are going to want to get adjusted, because we know now that it changes hand-eye coordination. It makes it better. And again, there's all the research that shows that. So here you go, Nancy. The prefrontal cortex, the brain's conductor. And so chiropractic care influences that. So we know that people that get their subluxations adjusted, they do better, okay? But there's several ways to look at chiropractic. How many people have ever heard somebody say, I don't believe in chiropractic? Yeah, I mean, everybody has, okay. People tell me that, okay, yeah, they don't believe in it. Okay, well, that's okay, no problem. Knock yourself out. I mean, take some opioids. But so chiropractic is only good for pain relief. How about that? Anybody ever heard that? Yeah. So I get adjusted when I need it. Okay, when I hurt, I'll get adjusted. Okay, that's a way to look at it. Okay, but how about this? Chiropractic enhances the way my entire body works, and thus the expression of life and organ function. So here's a way of looking at it. So if you get adjusted, say you get adjusted whether you feel you, quote, need it or not, means you don't have symptoms, okay? So what you're doing is you're keeping your nervous system healthy. You're keeping your your neuromusculoskeletal system healthy. And down the road, there's a good chance that can prevent you from having some sort of joint replacement, okay? And so are joint replacements cheap? No. Is back surgery cheap? No, none of that's cheap, okay? It's actually a lot less expensive to get adjusted even when you're out of pain than it is to wait and do what we've been taught to do, is you wait till you get symptoms, then you go to the doctor. Well, when you get symptoms, a lot of times it's chronic. Not always, but a lot of problems are chronic when you get symptoms. So you can use chiropractic as an aspirin. And you don't have to believe in it. I mean, I'm not going to force you to. Or you can use it as a way to try and keep yourself as healthy as possible. Now, are there other things involved in that? Yeah, there's diet, there's exercise, there's getting enough sleep. All of those things are important. But chiropractic, to me, health is a three-legged stool, primarily. Diet, exercise, chiropractic. If you can do those three things, you're going to stay healthy. You're going to stay way healthier than the average person in our culture. So chiropractic isn't necessarily designed to make you instantaneously feel better. And I have patients that, I adjust them for a while, and it takes a while to feel better, okay? But it's designed to instantaneously make you heal better, okay? And you don't always feel healing, okay? You don't always feel it immediately. And you know that, I mean, even, let's go to the medical model. Let's say you go in, you have a really bad sore throat. Physician gives you some antibiotics, okay? Which isn't, could be a very appropriate thing to do. So you take a pill, take 2 pills that day, one in the morning, one in the evening. Is your sore throat gone? No. Probably not, okay? It might take 3, 4, 5 days of taking those antibiotics, okay? But is there something going on even if you don't feel it? Yeah, there is. It's the same way here. When I adjust somebody, it releases responses in the body that can last for hours or even days. You may not even feel it. And you may have a liver. Let's see, where are we here? So, how many of you know if your liver is functioning like it should? How many of you can tell that? How many of you can go, yeah, I think it's all right, so it seems to be okay. I mean, no, we can't, okay? So if your body's trying to detoxify, which is the liver's job, by the way, does it need 100% nerve supply? Yes. Yeah. And we don't know how good that's working, but if you're not getting adjusted, we know one thing, it could not be working well. Your heart requires 100% nerve flow without interference to work right. So so chiropractic, or your nervous system, is essential for normal organ function. I see a lot of people with bad livers in my office, okay? Sometimes I can just put my hand on the liver and tell if it's not working. I can do that probably 50% of my patients. But it requires good nerve supply to work right. Now, Keith Wasson, he's a lay person, but done a lot of really good work on chiropractic education. He says, thinking of chiropractic as pain relief is like robbing a bank and stealing only the pins. And they don't want you to steal them, they have little chains on them, They can't afford to let them go, Okay, so here's the thing with cortisone. Cortisone is a lot of times what people feel they need if they're in a crisis, okay? Sometimes cortisone is necessary. I'm not saying it should never be done, but cortisone numbs the area, it reduces inflammation, but does it actually correct what's causing the problem? It doesn't, okay? Now, there are times when I've thought that cortisone was the right thing for some of my patients, and I haven't objected to them getting it. But I want to show you a study. This is in a journal called Radiology, 2019. And here's what it said about steroid injections. They cause accelerated osteoarthritis. subchondral insufficiency fracture, complications of osteonecrosis, which is the bone just dying, and rapid joint destruction with bone loss. Okay, so cortisone has some problems associated with it, and it doesn't always work out very well. Now, what's interesting is I had a friend who worked at Nebraska Orthopedics, and they were charging like, I think, I don't know, you remember, it was $1,000 for a cortisone shot into the spine. I mean, you can buy a lot of care in my office for that, you know. That's a lot of money, I thought, for, you know, a shot into the spine. So chiropractic may be slower at times, but it's much more in tune with your body's need to feel safe. So your body, it gives you pain for a reason. So when you cover up symptoms with pharmaceuticals, it's like taping over the oil light. The oil light goes on in your car, okay? Anybody ever had that happen and ignore it? Happened to me when I was a teenager, 16. You know, my engine blew up out in the middle of nowhere in West Texas, and it was a bad day, I'll tell you that. It was a really bad day.
Never let that happen again.
Yeah, yeah, I really pay attention to my oil now, you know, I mean, you only do that once, okay? So we're not here to hide symptoms. We want to fix the underlying cause of the problem. Okay, so this is something that I ask on my first test. What percentage of your nerves feel pain? Only 10%. Only 10% of your nervous system
Is it the
perceives pain.
surface of the nerve then, Paul, that feels that, or what part responds to pain in that? Because you got several cords coming out of it.
Well, so you have certain nerves that experience pain and certain nerves that don't.
Oh, really?
Yeah. So, for example, if somebody opens you up, like a surgeon, and just cuts through your intestine, okay, you will not experience pain. They slice clean through. But if your intestine bloats up, like you have intestinal gas, anybody ever had gas pain before? Yeah, oh yeah, you can feel pain then, okay? So only 10% of your body deals with pain, only 10% of the nerves. The other 90% deal with what? Function, okay? So, and when I ask people that, I go, what do you mean? What do I mean by function? Well, like lifting something up, like using your muscles, okay? Seeing, hearing, tasting, smelling, digesting food, running, balance, all of that's function. So only 10% of your nervous system deals with pain. So, you know, pain is not a great indicator of how healthy you are. Okay? Right. Because, again, when people come in, I lay them on the table, I check the strength of their legs. Both their legs are weak. That's a functional issue. They don't even know they had it. No pain, loss of function. Okay? So you can have a lot of loss of function and then until you have symptoms. And that's, a lot of people wait till they have that, and that's, you know, heart attack's a good example of that. You know, other things are examples of that as well. So now kids that are subluxated, they can't always express pain, but they have colds, allergies, food intolerances, behavior issues, ear infections, and sore throats. So I'm going to just skip over some things because it's taken a while. So Tour de France riders, they all get adjusted, okay? I'm going to say that's when they're not doping, right? So they all get adjusted in between legs because they racehorses get adjusted. I've adjusted horses, okay? I adjust animals. So horses perform better when they get adjusted. Animals are a lot healthier. They live longer when they get adjusted. So we don't just adjust people to get people out of pain. We adjust people because it's the right thing to do. Just like we drink water because it's the right thing to do. We take supplements because it's the right thing. So that's why I adjust patients, because it's the right thing to do in order to keep people healthy. And so some of you probably, most of you here are patients of mine. In fact, I think all of you except Terry's a patient of mine. So And you may know some people who are struggling with their health and struggling with dysfunction in their body. And I would encourage you to at least have them get checked. Have them come in, get a subluxation check. We do that at our expense. If we can't help them, we'll let them know. If we can, we might be able to save them from a lot of discomfort and a lifetime of problems. And if we can keep people out of the operating room and get their life back to them, they can live and function normally. And if I can get people to be healthy enough not to have a joint replacement, you know, that is something that I want to do. And I mean, I'm 70. I don't have any artificial knees or hips, and I don't plan on it either. And so that's what I want for my patients. That's what I want for our culture. And you know, I think, and I truly believe this, is that if everybody got adjusted from the time they were 35, which is when my mother started getting adjusted, and she's 93 now, we could probably cut down on joint replacements by 50–60% and probably decrease the disability in our culture by that much as well. So it would save our society a lot of money and save people a lot of surgery. And that's what I want to do here. So I would urge you, let Carmen know, or have if your friends or people you know want to at least get checked, let Carmen know, and I'd be glad to check them. They don't have to be a patient, but I would say at least get checked for subluxations, at least find out. So that's all I have for you. It's a little after 7. I kept you 5 minutes later. Anybody have any questions or anything I've gone over? Good, clear as mud. All right, great. So the next talk we're going to do in 2 weeks is a functional medicine approach to cancer. And that's going to be a lot of interesting things in there. I'm going to tell you ahead of time, I don't treat cancer. I don't take people off chemotherapy or tell them they should have it. But there are a lot of things that you can do to prevent it, and if you get it, to help yourself along in the healing process. And that's what that talk is about. So I'd love to have you here for that talk. There's a lot of great research. I'll just give you a little teaser on that talk. Do you know who the first person was? One of the primary people was that wanted research into how nutrition affects cancer, because his mother died of cancer. Anybody know who that was? You're going to be shocked when I tell you. It's Adolf Hitler.
Oh,
Adolf Hitler. He's the first person to encourage research into that area. Okay.
Wow.
So that's a little teaser on functional medicine and cancer. So anyway, we'll see you in 2 weeks. Thanks for coming tonight. It's getting a little warm in here, actually. So thank you very much.